Next.
One. Hi, I'm Dr. Bruno,
Hi, I'm Hollis Silverman.
and we're going to talk about the difference between depression and anxiety. Often my clients come to me and they're experiencing either depression or anxiety. And what I find is that they're actually experiencing both of the disorders or a little bit of each at the same time, which is quite prevalent in the United States, according to my research. About 58% of the population is struggling with both anxiety and depression, and even the World Health Organization has said that depression and anxiety are the most prevalent diagnoses in Western culture.
And the reason why they're the most prevalent in the Western and Eastern culture is because but something that happens is the neurotransmitters in their neurological, biological axes become very low due to low levels of serotonin and norepinephrine. And what's interesting is that even with norepinephrine, you could even get heightened anxiety levels. So a lot of times, practitioners have a hard time deciphering, well, is this more of somebody that has depressive symptoms or anxious symptoms? But most of the time, it's usually a combination of both. As we've seen, Dr. Bruno, a lot of our patients come in, with both. They'll come in with depression or they'll come in with anxiety, and sometimes the anxiousness will come first, and because of the anxiousness or
They get
maybe
depressed.
Mhm.
Yeah. In the field, we don't even categorize depression and anxiety as per the DSM. There's a growing body of clinicians that really feel that depression and anxiety are on the same axis, and that if you're anxious, you have an active depression, and if you're depressed, you have a vegetative depression. So, and bridging off what Paula said is, which is very true when it comes to picking the right medication, and norepinephrine, which is involved in the fight or flight process in the brain. So when you get scared, you either freeze or you run. And that's evolutionarily, it's important to do that. However, when you're dealing with someone who's dealing with both depression and anxiety, and you're dealing with a new med that's working on norepinephrine and serotonin at the same time, they might get less depressed, but at the same time they get less depressed, they're getting more anxious because it's raising the level of norepinephrine in their brain. So it becomes sort of a Sophie's choice situation, where what can I deal with more better, or what can I cope with better, depression or anxiety? I know for me, I'd rather be more anxious than be more depressed.
Oh yeah, I'm with you, Dr. Bruno. That's exactly it. Yes. And oftentimes, because our clients are so fatigued or they're drained because of the anxiety, it is a Sophie's choice. Like, would I rather feel anxious or would I rather feel depressed? And it's troubling, and it can be really burdensome for our clients. But there are a lot of other coping skills that you can learn to help subside some of those symptoms.
Yeah. So if you take some meds, what I really try to work with my clients with anxiety is the behavioral aspect of it, and the cognitive aspect of it. Once their depression lifts, they can work through that. But it's very important that the depression lifts prior to doing those things, because frustration can come about, and when we're frustrated, we shut down. But what's important is to figure out, or to delineate, what is anxiety and what is depression, or what are those specific symptoms, even though they overlap, so that when you go to your mental health professional, you can explain as best that you can what you're experiencing, and so you can get the best care.
Absolutely. The key symptoms of anxiety include the whole body: fatigue, restlessness, or sweating; behavioral, hypervigilance or irritability; cognitive, racing thoughts or unwanted thoughts.
Key symptoms of depression include your mood can be anxious, apathetic, you can be generally discontented, feel guilty, hopeless, inability to feel pleasure, anhedonic, dysphoric. You could have mood swings or just relative sadness. Sleep, you could wake early, you could have excess sleep, you could have intermittent sleep, you could have no sleep. In your body, you can feel too hungry, not hungry enough, feel fatigued, or restless. Behaviorally, you could be agitated, you could be crying all day, you could be irritable all day, you could isolate yourself socially. And cognitive, your concentration will decrease, you might be labored in movement, thought, or speech, and you might have thoughts of suicide and or sometimes homicide. So now you know some of the differences between anxiety and depression, but most importantly, you know that you're not going quote unquote crazy when you feel like you're experiencing both at the same time. Because nine times out of 10, if you're experiencing some levels of symptoms of anxiety, you're going to be experiencing some symptoms of depression.
Absolutely. What I recommend too is practice relaxation techniques, even if it's for a couple minutes a day. Just some deep breathing. Listening to some calming music, doing things that can promote either feelings of joy
Mm-hmm.
and just feelings of calm. Very important. Exercise. A healthy diet that helps promote feelings of content, feelings of calm, and also really relying upon your social support system is vital in helping you during the times of if you're feeling sad or you're feeling anxious. So those are just some of the coping skills out of many that you can use to help you during these tough times.
Thank you.
We look forward to seeing you soon.